discussion coming up here from 11 till 12ish. And happy Extreme Heat Awareness Week, as I would be remiss if I didn't mention to everybody here and the rest of the great state of New Jersey. I'm Kelvin Bodie, the Director of Healthy Homes and Communities at the Housing and Community Development Network of New Jersey. I'll just call it the network from here on out if I refer to it for everybody's sanity. And I'll be the moderator of today's webinar. And just very briefly, the network is a statewide association of about 250 70 nonprofit housing and community development corporations, some individuals and municipalities, and a few other corporations and philanthropic foundations dedicated to really just making sure that the promotion of more affordable housing development happens across the state in terms of funding and policy. And today we've been partnering with the DEP, Department of Environmental Protection, and the New Jersey Interagency Council on Climate Resilience, established 2019, I believe, to develop and implement New Jersey's statewide climate resiliency strategy. We are actually one of the few states that does have a heat plan, and I hope that everybody's excited to read it or has read some of it already. But as a part of that conversation, we're also going to be discussing ways that we can find some practical strategies, development strategies, things that intersect to protect some of New Jersey's most vulnerable and unhoused populations, especially as it relates to extreme heat and heat waves, that we know that the state is one of the fastest heating up areas, not only in the country, but in the Northeast as well. As utility crisis crime as well, we know that this conversation is also just going to become more broad. I just want to say as some general housekeeping rules before I kind of dive into it, that this webinar is being recorded and it will be posted to the event pages of the NJ Heat Hub in about a week or two, so keep your eyes out for that. Right now, I'm sure the audience members have noticed you are in listen-only mode, just so we can make sure the presenters have they're rolling out their good information and their discussion later on. And each of our panelists, as I'm kind of alluding to, are going to provide a short presentation about some successful heat interventions that they've done for the unhoused in their line of work. And we will have some space for Q&A from audience members afterwards. If you do have questions, we ask that you use the chat feature, and we'll do our best to get them over to the Q&A section as the session itself is wrapping up. And in the meantime, we're just going to ask that the audience members just introduce yourselves very quickly in the chat. Just briefly your name, your title, and the organization that you're from or your affiliation. We also will have one or more staff members of the co-host organization sharing links and resources as the session is going on. So we encourage you to kind of peruse through those and save them and put them in your back pocket for later on. So that is the general housekeeping out of the way. The actual kind of nitty gritty, the meat and potatoes of this session here is extreme heat and the heat waves that we're facing in the state, as basically the extreme temperatures, both hot and cold, continue to rise as the years go on. Right now, we're using the point-in-time dashboard count from Monarch Housing Associates, one of our members. I have to give them a shout out. And it shows an 8% increase in homelessness from 2024 to 2025. That's the highest number of individuals reported since 2014, so about 10 years ago, and about 2,000 of them are unsheltered, staying outside or in some kind of vacant or abandoned property that really isn't fit for habitation. In addition, not having an adequate roof or other kinds of weatherization features within your home also means that you can lack proper facilities, electricity for air conditioning, access to clean, cool water for hydration, things of that nature that seem like no-brainers when we take them for granted. As I kind of alluded to before, the state is warming faster than the global average. Heat waves have, and they're going to continue to just get more frequent here in the Garden State. We've had some cool summer evenings in the past as a break from some of these temperatures, but we're hitting a point now where the new normal is just nighttime temperatures are barely going below the daytime temperatures, or just not in an amount that's significant enough for folks to live comfortable lives without shelter. So the Interagency Council on Climate Resilience has brought together a bunch of stakeholders and government agencies to help improve coordination with this, among other kind of efforts going on the side, really centered around extreme heat. As I was kind of saying in the beginning, about 2 years ago, the Interagency Council released the NJ Extreme Heat Resiliency Action Plan. This is the third of its kind in the country. New Jersey is usually hard-charging, very unique in doing some of these things. Glad to say we've kept our reputation strong there. And under the leadership from DEP, Environmental Protection, has been collaborated to launch really kind of a broad-based heat outreach and awareness campaign. This is part and parcel of that. And for example, NJ Heat Hub, where this presentation will be posted later, is the digital kind of platform, the one-stop shop, if you will, that includes applications such as interactive maps and other resources to help folks find some relief from the heat. So with that in mind, today I have the privilege of really introducing a panel of experts here, like I was saying, who are going to speak kind of more kind of truth to power on this subject than the broad overview I'm giving. And if you really want to read more about the folks here that are going to be speaking, we do have their full bios and their information up on the Heat Hub NJ. So I'm going to go a little out of order here because we're going to have our folks from Arizona speak first. But joining me from Arizona are Dr. David Hundula and Scott Hall from Phoenix. It's a city that without really much explanation needed, even though we're not near Arizona, is very much on the front lines of extreme heat, being in the Southwest just naturally. Uh, Dr. Hondulo, or David, is Phoenix's Director of Heat Response and Mitigation, while Scott Hall directs the city's Office of Homeless Solutions. On the New Jersey side of things, we'll be hearing from Michael Callahan, the Chief Operating Officer for Bridges Outreach New Jersey, also a member of the network. Thank you. An organization working to end homelessness through direct street outreach, intensive case management, focusing really around mental health, housing, and independence and economic achievements. Thank you for, and also, let me not, like I said, I was going out of order, so I almost got to the bottom of my list, even though it wasn't the bottom. Raquel Cooper, the Director of Unhoused Services for the Collaborative Support Programs of New Jersey, also an organization providing peer-led value-based services that foster wellness, recovery, housing stability, and advocacy. As you can see, we are joined by folks who live, breathe, and believe in the work we're doing. And our first presenter actually today, to start from a zoomed out perspective, will actually be going over to the western part of the country with Dr. David Hundula and Scott Hall. And this is my point where I stop yapping a bit and you guys can step in.
Well, Kelvin, good morning, and thanks to you and Alec and our friends at DEP and the Interagency Council for the invitation to speak with you all. And good morning from a warm and sunny Arizona. It's a real pleasure to be here, especially as somebody who grew up in Bridgewater and was in New Jersey through high school. But happy to be joining you from the Southwest with my colleague and teammate here at the city, Scott Hall. Our plan is that I'll share a little bit of the city's overall approach to heat and the motivation behind our heat plan and some of the elements in our heat plan. And then Scott will set the context for the state of homelessness and work on homelessness here in Phoenix. And he'll really be focusing on the specific programs and services from a homelessness perspective that are closely coupled to and supporting the heat plan. We can move on to the next slide. Thank you. Like it is here in Phoenix, it's an incredibly collaborative effort on heat, and we've been so fortunate that so many folks have come to the table in convenings like this and others, whether it's knowledge sharing or contractual relationships to move the work forward. We certainly recognize that the city can't make any meaningful progress without great community support. And even within the city, as we move on to the next slide, something that's been really kind of a joyful surprise to me since coming to the city. I've been with the city in this role for 4 years, is how all the city departments have a role to play in this work. It's actually very hard on our org chart to find a department that we can't argue has a role in heat, whether it's the forward-facing departments like our paramedics and the fire department, who are, of course, saving lives every day, to our friends in the legal department and budget and finance, who really make the engine of the operation go. Now, next slide, please. Just a little bit of motivation and set the context a little bit for work on heat. I mean, of course, we are here today because we all recognize that heat is a public health challenge. And just to provide some Phoenix flavor to that, here we're looking at monthly totals for heat-related 911 calls in the city. Over the past few years, our fire department has implemented a specific tracking system when the paramedics are in the field performing a rescue that may be heat related. They are logging additional information about those calls. About 2,000 calls recorded last year. The toughest day from a heat perspective is probably on the 60 to 70 to 80 call range, which could represent 10% of the total 911 call volume that our paramedics are responding to. So as we're thinking about reducing fire department response times citywide, we certainly hear from our friends in the fire department that anything we can do to prevent the heat-related calls from showing up on their list will be helpful for citywide response. And the fire department is a huge partner in these efforts. You can see some of the other information that we're able to collect about our heat-related 911 calls, roadway and transportation settings, the largest category, residential cases also concern. And I'll draw your attention to the bottom bullet point here. Last year, 670 of those 2,000 heat-related 911 calls were among our neighbors experiencing homelessness. And to put that number in perspective, in Maricopa County here in central Arizona, of a population of about 4.5 million, about 0.1% of the population is experiencing unsheltered homelessness. So contrast those two numbers, 33% of the total call volume, coming from 0.1% of the population, a hugely disproportionate impact. Next slide, please. We also are fortunate to have really good data from our partners at the Maricopa County Department of Public Health. They are the health authority here in Central Arizona, and they've been tracking heat-related deaths with a consistent method for about 20 years now. These are county-wide totals, and you can get a sense of the scale of the challenge that we've been facing, with hundreds of heat-related deaths reported in Maricopa County in each of the past several years. And you can see what that trend looked like going back a decade. But signs of optimism, signs of hope that the numbers are moving in the right direction over the last couple of years, including a notable 30% decline from 2024 to 2025. There's a lot of work ahead of us to really understand what's driving this variability, but I hope today we'll leave you with some hope that some of the investments that the city and our partners have been making are part of that story. And I'll invite everyone to visit the Maricopa County Department of Public Health heat-related dashboard. This is a screenshot of that dashboard. The link will be shared afterwards if you're interested to get more information about what they are collecting and how they're reporting it. And just draw your attention to the bottom right corner here. Heat-related deaths among our unsheltered neighbors, almost 50% of the cases last year. And again, that's coming from 0.1% of the population. So today's conversation is essential, and it's one that we're having every day here in Phoenix. If we're interested to move the numbers on heat-related illness and heat-related deaths towards zero, we need to be starting with the conversation we're having today. Next slide, please. Recognizing these significant challenges related to heat, the city has a heat response plan. Our city council has unanimously adopted and updated it each year since it was first presented in 2022, and it addresses these 6 strategic priority areas. We'll be touching on a couple of the different actions that speak to these priority areas, but something I'd highlight in the first category here, first responders. The very first action in the heat plan speaks to the work of our paramedics. And the very second action speaks to our social service first responders, some of the outreach teams that you hear about later from Scott. We really thought it was important to elevate and prioritize their work as an absolutely essential component of the plan, and they're positioned very highly in the plan accordingly. Next slide, please. The plan has approximately 24 specific actions, and just to give a flavor of what some of those are, here in Arizona, like in New Jersey, there's a vast coalition of partners that participate in providing publicly available cool space. Here we call it our Heat Relief Network. The city of Phoenix is a big player. Here in Central Arizona, there are about 60 municipal buildings that operate as some form of cooling center or hydration station, and we'll learn about our best facilities in a few moments from Scott. We've been working on a new training program for our employees to understand the full scope of the city's heat response programs and services. Our long-term dream is that if you had a question about what a cooling center is, you could have that conversation with your trash collector, for example. We're trying to build a very high foundation so that all employees can be ambassadors into the program. Phoenix has a cooling ordinance that protects rental properties. Happy to chat more about that with anyone who's interested. 82 degrees is our limit for homes with central air conditioning. And we also have a lot of proactive education. Here you're seeing a picture of our community emergency response team volunteers who are out at some of our popular hiking trailheads on weekend mornings through the summer to encourage all hikers to stay safe. And behind all of these actions, there's a really strong platform of coordination. We report out weekly to the public, to our elected officials, and over the last 4 or 5 years, our emergency management teammates and our fire department teammates have really leaned into this work. There are portions of the heat plan that use the incident command structure to help with coordination and reporting. I think I have just one more slide before we hand it off to Scott. Nope, this is the time where we hand it off to Scott. So against that backdrop, that Phoenix has a lot going on the heat front. So happy to introduce somebody I've learned a lot from in this work, Scott Hall, who will present from the perspective of the Office of Homeless Solutions. Scott, thanks for being here.
Thank you, Dr. Ondul, and thank you guys for having us. It's kind of cool, being out here on the west side and and talking to you guys on the East Coast over there, and it's kind of odd that you guys are dealing with some of the same issues of heat-related and weather-related issues, especially for our vulnerable populations, and that's where my office ties in. About 4 years ago, the city wanted to take a more proactive approach on all kinds of subjects, and two of those was heat, or one was heat, and one was also how we addressed homelessness. So what we did was we created the Office of Homeless Solutions. And just for some context within that, similar challenges that I think most states are dealing with is the economic pressures of the impact of homelessness in our community and the resources that are available. Unsheltered homelessness, which to this category is one of our primary targets for people we're trying to engage with because of the lethality of the weather out here in Arizona. And again, we created a strategies to address homelessness plan and then created the Office of Homeless Solutions to implement that plan. And currently we're on our next phase of that strategies to address homelessness plan too. But some of our new focuses after we've done some of the stabilization and heat things are going to be prevention, housing pathways, and improving our system. Next slide, please. So some of the recent results we've had with our office and our collaboration with some of our city partners has been, over since 2022, we added 1,800 temporary and permanent beds. Of that 1,800, 1,200 shelter beds were permanent and new. We created, 300 spaces through our safe outdoor space, and I'll get more into what our safe outdoor space in just a few more slides. And then we expanded and restructured our outreach to reduce the barriers for people coming in for connections of services. And we'll talk about that in a little more detail as well. So coordinating our efforts and extending our hours for our heat relief locations was some kind of low-hanging fruit. And I hope what you hear through our presentation today is how each year we've built on the successes and learned each year, and we continue to improve. And I think not only has city leadership, but our constituents in our city have seen that strategy, taking one step at a time, building on each other, and not reinventing the wheel every single year, having some absolutely new thing so that people could get on board and be supportive of it. And so far, our neighborhoods have been completely supportive of our efforts related to heat relief. The operation of the safe outdoor space, it was really one of the first of its kind, where we created a safe outdoor space that was shaded, had cool space, had all the same resources as a high quality shelter. And we've had a lot of states come in to see our safe outdoor space and how we implemented that and the effects of that. And then our outreach teams. We probably have one of the largest outreach programs throughout the country. We have an internal outreach team. We have multiple outreach contracts, and they all have kind of specific rules on what they're or scopes of how they're engaging folks that are unsheltered out in the community. So we're not just stepping over the top of each other, and we really coordinate those efforts. So some of those coordinated efforts were in 2025, we continued to build on that success of our heat relief options. And when we first started our heat relief, our first 24/7 one was actually at our biggest, most predominant library in Phoenix. And that was successful, but it also came with a litany of issues that we had to resolve. And one was the location of it. It was right smack dab in the middle of an area where there was a school, where there was one of our largest parks. So it had a lot of issues that we had to overcome while doing that, but we also learned how successful it was and how it could really impact and save lives. So in 2025, which was our second year at our 20 West Jackson facility, which was a building we rented right downtown, and it's not hidden. It's right next to some predominant businesses, right next to where the Phoenix Suns play. And at first, people were hesitant, like, what are you going to do to our businesses? What are you going to do to our downtown? Now they're all proponents of it and see the success of it and want to see it continue. We also extended library hours, which is kind of that low-hanging fruit. Instead of closing the doors at 5, can we close the doors at 9 when the sun goes down? And again, people got on board with that. And then it also had an added benefit where people who weren't able to make the normal library hours because of work, school, whatever it might have been, now we're able to enjoy library resources. So it wasn't just open to people for heat relief. It was the full library experience. So we got a 2+ out of that one as well. And then in 2025, as you can see here, we saw almost 5,700 unduplicated people at these resources, which was each year we continue to exceed the number that we thought we would anticipate seeing. But the other bonus in that, when we resource things right, is as you can see down below there was 751 placements. That means 751 people that came in for our services got off the streets, either into shelter, housing, inpatient treatment. Might have been in that success is really what's got city leadership to continue these efforts and put the right amount of resources in. Next slide, please. And then in 2026, we continued our 24/7 heat respite. And what you're looking at here is actually our family room. Our family room is for any adult that has any children under the age of 18. Uh, Not going to lie, the years prior, it was a real challenge because there is a wait list for our family shelters here in Arizona. So we were really having to dial for dollars, temporary hotels, all kinds of things, trying to get our families off of the streets and actually out of the 24/7 environment because there was a lot of single adults with other issues that we really didn't want kids to have to be around, but it was a necessary to get them out of here. So what we did this year is we partnered with UMOM, which is our largest family provider. And now what happens when a family shows up in heat relief and they're unsheltered, UMOM, we transport them through our CAP team and they're at UMOM within 30 minutes and UMOM's getting them into an indoor space in a family setting that's more conducive with the young kids. And then we have some new locations of operating. We down around our human services campus, we have an organization called the Justice Center, which is a 55 plus service for individuals that are experiencing homelessness. But what they do after 3 p.m. is they open it up to everybody so that it's also a heat relief center and mitigate those type of issues. And we also provide transportation for any of the heat relief sites that we have that close at a certain time. We will transport anybody there that's unsheltered to the 24/7 heat respite if we haven't already placed them in shelter so that they can stay indoors so they don't have to go outside unless they choose to. Next slide. And then our outreach teams. This is really where we started with David's team when we first got started, when we were first creating the Office of Homeless Solutions. We partnered with David's team. His team was obviously the experts on engaging people, heat-related issues, all that. But I teamed our team up so when they engaged those that were experiencing homelessness, we brought our expertise in as well. And those efforts really were, I think, the foundation for the partnership and all city departments getting on board with working with David's office to mitigate these heat-related issues. And then we also created behavioral health engagement teams, which had a primary focus of part of their time isn't just spent doing outreach and engaging people, but also building relationships with treatment centers, behavioral health programs, and other resources so that they had a more immediate connection to things outside of just the emergency shelter to hopefully get people connected to the right services more immediately instead of that delay of going through shelter. Maybe the issue compounds, it gets worse, or they get kicked out of shelter because the issues weren't addressed, and trying to get people into the right service immediately. And then the OHS outreach teams. And just, this last year we engaged with 1,400 people with our own internal teams. And one of the cool things I like to brag about with our internal teams is, and it's a trend that I think is caught on across the country, especially here in Arizona, is majority of my team is people with lived experience. People with lived experience that have backgrounds from substance use, mental health, homelessness, even incarceration, and now they have these opportunities in a job that has a pension, good benefits, but they're also getting to pay back for what was given to them. And it has been amazing working with our peers here within the city. Next slide. And then this was our safe outdoor space. And I love that we have a picture of it up here because a lot of times when people heard about the safe, they just thought about putting tents out in the middle of nowhere. And that's what, sadly, a lot of our constituents and even elected officials were thinking, oh, we have a lot of BLM land, why can't we put them just out there? I was like, that doesn't work in our environment. I don't think it works in any environment, actually, because they're still members of our community. We're not trying to tuck them away out in the middle of nowhere. We're trying to engage them and get them the quality of life that they deserve and that they're looking for. So we actually partnered with the state on this property because it's a stone's throw away from our Capitol building. I like to brag about that too, because again, we're not trying to tuck it away, not trying to hide it away. But this was the old state surplus yard, and the state actually gave us the money to purchase the property. Then what we did was we put fire life safety up underneath the canopy there. We added the turf, bird netting, and then it also has, you see behind it, the warehouse space. In the warehouse space, it's fully air conditioned with office spaces. So they don't just have to be out here in the heat that's shaded. They can also be indoors and getting cool as well. And again, this was just an alternative to indoor shelter for those that just weren't ready to go to indoor yet. Our goal here is always getting into a safer indoor space. But we're a little bit of a victim of our own success because a lot of people prefer to be here instead of a congregate shelter. And I don't blame them sometimes. You have your own space. It's clean. It's nice. It's downtown. But that is still our goal of getting people in. And as you can see, we provide the tents because we want to make sure they were fire retardant and that the place always looked nice. We always wanted to create high quality places so that people feel a little bit prideful where they're at and not ashamed to walk in there at so they can take those next steps forward. Next slide. And then everything we've learned, we had higher than anticipated demand, especially on our first opening.
Scott, I think we lost you. Your mic cut off. Yep. You did warn us that could happen, so no surprises there. I think Scott just has to reconnect real quick, or maybe David can take over.
Yeah, thanks. Yeah, as Scott was alluding to, we saw a lot of success that first year for our 24/7 site. But in the first year, we really looked within our public facilities, where could we run 24/7 heat relief? And the location that the data guided us to was our central library. But as Scott alluded to, and we did encounter some challenges. I think Scott would describe that we knew the types of challenges that were coming, but we didn't anticipate how popular, how much demand there would be for the site. So while we knew the types of challenges that were coming, we probably didn't correctly anticipate the scale of the challenges that were coming, and that certainly created some tension that we had to work to resolve. Moving the location to another really good candidate from a data standpoint has been beneficial to us. And I think the important step there was we expanded our scope. We didn't ask just within our city facilities, where could we run 24/7 heat relief? We looked at the real estate market as a whole to try to find a location. Yep. Second, you've heard this theme from Scott already. There are a lot of different staff involved in this effort from a lot of different perspectives. And that's a non-negotiable for us. The chance to build those pathways into those positive exits, those positive outcomes that Scott talked about, is a really important part of our elected officials supporting this effort and the community supporting this effort. We've also had a lot of very, very thoughtful and deliberate conversation about what the security and safety model looks like. The police department certainly has a role here. Private security certainly has a role here. But we're also trying to ensure that the spaces are perceived as welcoming and accommodating to everyone who's seeking heat relief. So a bit of a balancing act there. Our elected officials and our community members they have a strong appetite for data to understand what is happening at these locations. And this has been a new data collection mechanism that the city has had to build with many new partners as well. It's almost every week we're working on a little wrinkle that's popped up in the data collection system, but whether it's hourly head counts at the facility, to information about who's coming in the facility that's willing to provide it, or even just to work toward those big numbers that Scott alluded to before, how many unduplicated visitors and how many total visits. That's been some new institutional muscle that we've had to build. And while these efforts certainly have ample challenges that we're happy to discuss, I think the most important message that we'd really love to leave this audience with is that this investment, which has been a big investment over the last few years, the city has really leaned into this effort. And there's no question that lives are being changed and lives are being saved every day. And we're hopeful that some of our lessons learned can be beneficial to other communities, and we look forward to learning from you all. So with that, Kelvin, we're happy to hand off to our New Jersey colleagues and or take any questions. But thanks again for the chance to share.
No, thank you for being here. As we all know, success is contagious and builds upon itself. So it's always helpful to hear some models that we can hopefully replicate on here in the great state of New Jersey. And with that, I think I'm going to turn it over without any further yapping on my end to our New Jersey folks.
Awesome. Thanks, Kelvin. Can we go next slide, please? Right. So Raquel and I are going to tag team this, right? Just by way of introduction, right? My name is Mike Callahan. I'm the Chief Operating Officer of Bridges Outreach, right? And then Raquel Cooper, who's the Director of Unsheltered Services at HCDNNJ. Next slide, please. Right. So, as we don't really need to kind of foot stomp this too much, right? But really, when one of the things that both Bridges and CSP specialize in across the state is unsheltered homelessness, right? If there's a vertical within homelessness services, right, there's a lot of folks in shelters, a lot of folks in prevention, there's a lot of folks in permanent supportive housing or rapid rehousing, right? Our two agencies really solely focus on drop-in centers and folks that are unsheltered, right? And just as we're coming off of Code Blue season and a very extreme winter, right, one of the worst the state's ever seen, right, we're quickly moving into Code Red season and also an extreme heat. And so when we talk about the population writ large, right, the challenges that really come are that there's no respite, right? So the majority of folks, and particularly as we see an emerging elderly population of folks experiencing unsheltered homelessness throughout the state, right? Cardiac conditions, folks that are on psychotropic or any other psychiatric meds, right, that impair the ability to cool, people using substances for a palliative effect, and just chronic dehydration, right, which at baseline is really super challenging for the folks we serve. Similarly, heat exhaustion, right? As opposed to, frostbite and some cold weather injuries, right? Heat exhaustion, particularly leading to heat stroke, right, can really happen under an hour and it escalates really quickly. And particularly, one of the things that, Raquel's going to talk a little bit about, and then we're going to talk, I'll talk about from Bridget's perspective, is how we organizationally support our street outreach teams to be able to do that, right, training is really key. And there's a bunch of great resources. The team at DP and DOH at Health have some really great resources for training. But then particularly in a lot of the municipalities we work with, I think a key takeaway is like the work that's going on in Phoenix is that, your first responder networks and the existing kind of public health infrastructure, right, they want to be dialed in, and we've never heard a no. We've only heard from, right, we have lack of capacity, but we'll still do whatever we can, right? And similarly, one of the other things to kind of just tee up what we'll talk about is that particularly, right, we have the Code Red legislation, which passed in this past legislative cycle, which is great, right? That's a first step, right? When we talk about really being responsive to people that are unhoused and experiencing homelessness in New Jersey around weather-related emergencies, right? Oftentimes people accept heat as, hey, it's hot outside, right? That, we can escalate things and be reactive, but I think as Phoenix has demonstrated, there's pre-planning and kind of iterative planning that's aligned with the actual strategic process really yields incredible dividends across the entire enterprise. Next slide, please. Right. So just talking about what we're going to be covering and what it looks like, right? Really delivering the services is one piece, right? And kind of the operations and the other items to include how you engage volunteers and how your organization looks at things from a development lens, right? That's really the two prongs of at least a nonprofit or a community-based organization or a CBO response, right? So CSPNJ, right, and particularly Raquel's going to go over kind of recognizing heat illness in the field, what a street outreach engagement looks like in New Jersey when it's 95 degrees over, right? Heat harm reduction kit, right? And what our joint teams, right? So CSPNJ and Bridges have we're in the 3 joint teams that work together across various counties of the state. Kind of what behavioral health and de-escalation looks like in the heat, and then trust, warm handoffs, and follow-up, right? For the Bridges side, right, I'll be going to be talking a little bit about kind of how we look at and build into our development of volunteer engagement processes and planning, right, for anticipating weather events, what volunteer mobilization roles look like, volunteer training and safety, and also how we do donor engagement and kind of supply drives around heat and cold weather, but majority, because our topic today, heat, right? And then lastly, kind of going into what we found to be kind of at least best practices here in New Jersey, even though we don't have as well developed a system as Phoenix does, kind of what we found so far. And so with that, right, happy to pass it over to Raquel. Raquel?
Sure. Next slide, please. So good afternoon. So recognizing heat-related illness, I'd say one of the most important responsibilities of every outreach staff is recognizing when someone is in danger, right? What makes that difficult, right, is that heat doesn't always look dramatic, right? Sometimes it looks like someone who is unusually quiet, or it looks like confusion. It looks like agitation. It looks like intoxication. It looks like a mental health crisis, right? So our teams have to, when they're out there, they have to make a split-second decision while in the field. They have to determine whether someone is simply having a difficult day or whether their body is quite literally shutting down because of the heat, right? So we've encountered individuals who appeared disoriented, only to discover they were experiencing severe heat-related illness. That's why we definitely take the time to train the staff to look beyond the obvious and always err on the side of caution, for sure. Because if we're unsure, treat it as like a medical concern first, for sure. You go to the next slide. So the engagement approach when it's 95 degrees plus, one of the things I've learned for sure is outreach is like, relationships matter more than resources, for sure. So when it's 100 degrees outside, people aren't interested in hearing about paperwork, right? They're interested in survival. Like, that's it. So we lead with humanity across the board, right? We lead with water, cooling towels. We lead with concern. We meet people exactly where they are at, physically and emotionally. And so during extreme heat, we often increase our contacts. We may check on the same person multiple times in a single day, right? We might even return several days in a row, weeks in a row if we have to, right? Because trust isn't built on one interaction, for sure. Sometimes the person who refuses help on Monday accepts transportation somewhere to an appointment on Thursday, right? The person who doesn't speak to us today, will wave us over and flag us down next week when we show up at that same location. So street outreach is often like a marathon rather than it's not a sprint, right? So the teams continue to just show up with consistency, and that's how we save lives. You can go to the next slide. So the heat harm reduction kit. People always ask what we carry during heat events, right? It's pretty simple. Tools that help people survive, right? Water, electrolytes, the cooling towels, sunscreen, hats, socks, always socks. That's all 4 seasons, right? Foot care supplies. And these may seem like small little things, but for somebody living outside, they make an enormous difference. What I love about harm reduction, right, is it removes all the barriers, right? So nobody has to earn a bottle of water, right? Nobody has to prove that they're ready for housing before receiving sunscreen, right, or a hat. Nobody has to complete an assessment to get a cooling towel, right? All those things. It's and sometimes it's offering those things all the time is what makes somebody then really, it builds that trust. And then next thing you know, first they're ignoring you, right? Next they're asking for a bottle of water or a cooling towel or something, some form of supply. And then a week later, now they're asking how you can help, right? So we provide that relief because we're human beings, all of us. I'd like to thank here on planet Earth that's what we are. And because reducing immediate harm creates opportunities for future engagement and connection, getting folks off the street. You can go to the next slide. So behavioral health, de-escalation in the heat. This slide is probably the most important for outreach providers. Extreme heat affects behavior, period, right? People become exhausted, frustrated, overwhelmed, irritable, disoriented, all those things, right? Extreme heat amplifies every last one of those characteristics, right? Those traits. For individuals already living in trauma, mental illness, substance use disorders, or the daily life of street homelessness, those effects can be even more significant. So our teams are trained to slow down. Sometimes the intervention, isn't a conversation, right? It's finding shade, right? It's giving someone a ride. Sometimes it's just kind of cooling out, kicking back and sitting quietly with somebody, sometimes it's offering water and then coming back again later, like circling around the block and come back again and check them again. But we don't just de-escalate people, we de-escalate environments, I like to say, right? And perhaps I'd say most importantly, remember that the person in front of us is not giving us a hard time, they're having a hard time, right? Like, so it's just a bad moment. And when we approach outreach through that lens, we create space for dignity, connection, and ultimately trust at the end of the day. You can go ahead to the next slide. So there we go. So if there's another thing I've learned, right? Trust is our greatest intervention, right? So people often ask like why someone doesn't just go to a shelter or accept housing, right? And the answer is usually much more complicated than people realize. Many of the individuals that we're out there serving have experienced like extreme trauma, system failures, broken promises, institutional mistrust, and years of surviving on their own. So when outreach workers show up, they're not, they're not meeting with us. They're meeting every experience they've ever had with the system prior to staff showing up, right? So that's why the consistency matters, because we continue to show up, and build that trust. And we don't show up once and then just disappear. It's not like drive-by outreach. We come back, right? We remember names, we remember stories, we remember what people like, right? Does this person like coffee, right? Who needs wound care, who's struggling with depression or the like, right? Who just recently lost somebody, like a loved one. Those are all things that the teams have to remember when out there. So, and the referral isn't the intervention, the relationship is, right? And when someone finally says, yes, yes, I'll go to treatment, or I'll go to shelter, or yes, I'll go to the hospital and check this wound out, or yes, I like this housing opportunity, this voucher opportunity. It's usually because trust was built over like dozens of interactions potentially. So, that trust can literally become the bridge between surviving outside and finding stability somewhere. You can go to the next slide. So, one of the things I think people don't often see much, right, is how planning happens before the heat emergency even occurs, right? So when the temperatures rise, our teams don't suddenly just decide what to do, right? The work begins long before the first heat advisory is issued, right? The same thing goes for code blue season. And, we definitely review the vulnerable individuals that we know are outside, right? Identify encampments, try to all the locations, right? Assess supply inventories for sure. Make sure we stock up on all the necessary, appropriate supplies for the season. Communicate with partners within the community. Prepare transportation options. Make sure we know all, the staff knows all the cooling resources, and that we can get that information out there so that all the individuals outside know all the cooling resources. Because when temps reach dangerous levels, right, we don't have time to just create a plan then. You have to know what's kind of going on, but it already has to exist, I guess. But, being prepared that way definitely, I think, helps save lives, right? The better we prepare for a heat event, the more people we can reach when it matters most, for sure. So, Mike, you want me to take next one, or you want to take next one?
Oh, I got it. No, that's perfect. Yeah,
Okay.
and thanks, Raquel.
Right.
And really importantly, one of the things that to Raquel's point is I think that this is fair across both organizations, is that our unsheltered teams, but also to the operational and strategic elements and the leadership philosophies kind of differ than the broader enterprise in a way, particularly around we have a more of so we use OTA loops, right, which is borrowed from the military, but also to FEMA response and kind of emergency management learnings, where it's observe, do, act, right? And kind of that OTA loop really kind of drives what we do. And particularly where organizationally at Bridges, one of the things that we've yield kind of that ability to support more strategically our street outreach teams during extreme weather events are kind of how we mobilize volunteers and how we leverage the extreme amount of goodwill that's across the state, but even within our donor base, right? And through this, we really kind of have 3 tiers of volunteer roles, right, at Bridges across that support the entire enterprise, to include some of our joint efforts and programs with CSP, right? And so kind of the first tier of volunteer opportunities that we do and socialize with folks that want to get involved with Bridges is, right, packing those sustainable heat kits, right, for Raquel's teams and for my teams as they go on their canvassing around, whether this is the city of Newark, whether it's Irvington, whether it's Plainfield, New Jersey, whether it's in Ocean County, New Jersey, right? Really the different level of tiers, right, comes from there's different folks that have different time frame and availabilities, but it also lets us socialize more broadly what the actualities of homelessness are throughout the state, and similarly that there's meaningful ways to participate in this process to help effectuate the exits of people from homelessness beyond just donating money. Right. And so really the first tier there is our packing of those sustainable lunches, but also to those emergency heat kits. Right. And so one of the things we do is we have a program called Teens Tackling Homelessness, or TTH for short, here at Bridges, and they are fantastic, right? So for the past 3 months, right, as we lead into June, so starting in March, right, they are tasked with, right, and collectively and as a committee, they go and they produce on a weekly basis more than 300 cooling kits for us for the summer, right? And that lets us know that as pre-positioned for late May and June, right, we'll be in a pretty good spot as we look at our run weight, right? Similarly, right, when we talk about field exposure, it's absolutely minimal, right? Churches can facilitate them, right? High school and interested folks can facilitate them, right? It's a great corporate social responsibility event too, in a good way there, right? The second tier of kind of that volunteer mobilization, right, is really helping our operations teams. And so we have dedicated operations staff and kind of a entire line of business really here at Bridges. And those folks that are looking for a little bit more of a substantive engagement, right? They help our operations teams, particularly along the weekends when our ops teams are a little thin, right? On supply runs, right? And this means restocking either one of our drop-in centers, whether that's at 35 Halsey in Newark, or our drop-in center in Rahway, or our drop-in center in Summit, right? And it's a light field role, right? But it gets people to understand, hey, this is actually a coordinated, robust response. Similarly, what's really interesting too is that oftentimes, you see our ops teams and our street outreach teams working with the municipal partners in government. And sometimes it's, just because there's not visibility of whether a city or a town, right, doing something, oftentimes we go and we see we're able to expose volunteers like, hey, yeah, the city of Newark is out with us. They're really doing something well. Or the city of Plainfield's fire department is out with you guys. Like, they're helping restock water. Like, that's fantastic. I didn't think we were doing anything, right? And really that creates that municipal trust, right, in government that really helps foster a more robust response there, right? And then a third tier, right, a volunteer opportunity that we offer is cooling center support, right? So all of our drop-in centers are cooling centers, just like Raquel's, just like CSP&J's drop-in centers are, right? And particularly this is a trained volunteer role, right? And so that this is a role that during surge seasons, whether it's code red or code blue, right, where there's opportunities for folks to greet, right, be able to pass around water, to hydrate, and to kind of orient guests, right? In this role, just based upon what it is, right, it is a volunteer role, but it is formally trained. We onboard folks like staff, right? Folks are screened, they're fingerprinted, right? We make sure that, that it's going to be a good environment and good interaction for everybody, right? And similarly, right, if needed, right, we also have a on-call surge roster, right? So that we're able to kind of supplement as needed. And that really came in handy over the winter with this past code blue season. Next slide, please. Right. So really looking kind of what that looks like is, from Bridges, with Bridges as a whole, right, is one of the things we identified years ago was that, the difference between a really strong volunteer experience and an experience that works for everybody, to include the person that's unhoused, the person who is housed but is volunteering, but also to the staff that are facilitating that, right, are really robust trainings, right? And so one of the things we require is, before you go to that tier 2 or tier 3, is that you have a certain number of hours and kind of a syllabus and a bunch of classes that you have to complete with us, right? And so when we talk about heat safety, is just like Raquel said, that the teams are trained on, right, the difference between heat stroke, right, heat illness and heat exhaustion, what that looks like, right? We're also training volunteers on, hey, spot the signs of heat illness, right? Also to know what their boundaries are, right? The difference between a professional social service agency and do-gooding, right? And understand that, hey, plugging in and supporting, we're all in this together, right? When and how to escalate with staff, and then also to what goes in a kit and what's the rationale behind it, right? Particularly one of the things that we've seen that has yielded a really good follow-on response is giving the why while we do it. So it's not just assigning volunteers a task, but it's giving them what the purpose of that task is and how that it contributes to the overall goal of ending homelessness, right? Similarly, right, one of the things that we do with all of our volunteers is safety protocols, right? So for folks that are in those tier 1 or tier 2 and tier 3 roles, right, we have a buddy system, right, on every field run, right? We enforce mandatory hydration and kind of shift limits, right? We do heat stress awareness for volunteers and what that looks like. And volunteers sign a document, right, that also lets us know, right, that, hey, if it looks like you're having a hard time, right, and particularly we have some folks that, just based upon their demographics or kind of what they have going on health-wise, right, they have their own limitations, right, then we make sure we know, hey, if we ask you, right, to sit down and whatever, right, you can only give when your cup's full. If your cup's empty, right, you're never going to be served that many people. Next slide, please. Right. So we talk about from a donor engagement, right? Right now, the cooling kit that Raquel talked about right there, right? That kit, right, which usually lasts about 3 days, right? That kit is running about $58 right now. Inflation had that kit last year, right, was $32, but inflation is kind of
Hey,
crushing
Michael,
it.
not to interrupt too
Yeah.
much, but if we can get to questions within the next minute or so, I know we're getting very close to the time here.
Oh, gotcha. No worries.
Yeah, sorry to be that guy.
Yeah, no worries. Hey, you're the facilitator, man. That's what the role is, right? So I'd say we can just jump kind of to the last slide, right? As far as a takeaway, right? Right. When we talk about the model works when we kind of move together, right? One of the things that, right, from an enterprise that we've seen is your volunteers, right? Like being able to engage volunteer base and really train them to go like help drive the surge roster, pack kits, understand unsheltered homelessness from the perspective of hot weather, right? Giving, right, working with your development team around weather related events, right? We've seen some really great donations come through from small corporations, but also too from folks that, hey, they really sympathize and empathize with the plight, right? And then similarly, referrals and making communities, right? Doing this work as nonprofits only works so far as your partnership with municipal government, right? And I have yet to meet a municipal government that doesn't want to do something, right? And that do something and really adding value, right, is a great opportunity. So thanks so much, and happy to pass it over for questions now.
That's awesome. No, thank you everyone for giving us the wealth of information that shows us the good work that is already happening that we can kind of charge ahead with. Sorry that things got a little tight with time there, but so far we do actually have two questions. One I think actually can be kind of just general for the good of the order, but I think folks will have a perspective on all sides of this, which is what is that conversation really? I mean, I'm sure you answered a little bit less of this in some of your presentations naturally, but as far as that buy-in goes, you were speaking earlier, all of you were, to the kind of the municipalities usually being on board, there being some kind of municipal departments that are allies, like the fire department or things of that nature. But what does that conversation usually look like, kind of just generally, as far as the getting that buy-in to happen, and then actually kind of like making sure that buy-in stays accountable once it's been, confirmed? I don't know who would like to step in first to answer that. I'm not going to volunteer anyone, but.
Yeah, Kelvin, I'll start, and then I'm sure Scott has much wiser things to say from a Phoenix standpoint. But I think we've benefited from trying to make the case for this work from a public health perspective, having data available that supports that argument. We have the heat illness, heat-related death statistics, and of course a pile of qualitative and anecdotal information, but then also describing how we have an informed, intelligence-driven plan to address the challenge. I think for our elected officials, that's been really essential. And I think they've been open-minded when the data has suggested something that maybe differs from what they imagined it would be. But Scott, is there anything more that you might add?
Yeah, there's the buy-in from the beginning, but then there's that ongoing buy-in. And our real philosophy for that ongoing buy-in is building on success. Like, we put a lot of effort and accountability and oversight into making sure whatever we implement that we have success, so that when we come the next year, we have every justification to ask for more, do it better, and get the right resources. So it's that really building on success and keeping accountable to whatever you're asking for and whatever you're implementing.
I'm sad we didn't get to Mike's slide, measuring what matters, right? Slide 14, I think it is, right? Because then that kind of, it kind of just shows like what you would measure. You know what I mean? Like what's important to bring to bear. And I like that, making it like a public health issue.
Yeah, I think more broadly across the state is that just like they did in Phoenix and Arizona, is that it's really when you take homelessness out of the idea of, okay, well, those are just the housing nonprofits and it's their issue to deal with. It's no, this is a robust public health response. And you really come from a place that I think, is evident from the team from Phoenix, where you're really affirming the dignity and worth of folks and that folks are worth saving, that if you give folks resources, they'll be able to get out of the way. And also too, I think, the key takeaway from Phoenix as a whole is, hey, we didn't try to do all this as once. We iterated on this, is we found something that worked and then we built this year over year. And, honestly, I think sometimes in New Jersey we get in our own way where we try to do everything all at once with these master waterfall plans instead of just, hey, let's start small, scale it up and go, and then, let things naturally fall into place to include partnerships.
I want to like challenge us to think about like another kind of measurement, right? Like, how do we measure a life saved because an outreach worker recognizes confusion as heat and calls EMS? You know what I mean? Like, how do we measure that? How do we measure those successes and throw that on a spreadsheet or something? You know what I mean?
That's actually a question I kind of wanted to close out with, which is how do we anticipate our metrics kind of growing as we go forward? Is it going to simply be like number of bodies in a cooling center or number of heads in a cooling center per night, or is it going to be number of referrals to a future program kind of off that pipeline? Which I'm glad that I'm sorry that we didn't get to your slide, Scott, on that, but I'm glad that was definitely at the front of our speakers' minds here. And a very quick question we also have is, does the program deal with pets? I think this is asking very quickly about the one in Phoenix.
Yeah, and I can jump right in that. When we're talking about, increasing our effectiveness of outreach and getting people to come in, we had to address the thing we called the 3 Ps. It was partners, property, and pets. And somehow pets became so taboo across all shelters and resources. Everybody was scared about liability. And what we did, City of Phoenix, is we just started allowing it first at our shelters, then at our heat relief stations, and knock on wood, it has been a non-issue as far as any liabilities. The only extra resource we have to get is pet supplies. And we have a lot of volunteer groups and nonprofit organizations that love to donate all the supplies we need for pets, but pets was a predominant way to get to solve for it, to get people to accept services and be able to come in. So that was a huge thing. But yeah, we accept pets in most everything we do now.
Absolutely. And it's just part of that process that builds trust and treats the folks experiencing this like our residents and our neighbors. I'm going to get to our quick ending piece here, but I want to say I'd be remiss if I didn't add kind of my personal soapbox very briefly, which is that, as we're kind of having this discussion, I'm glad that folks are thinking about, as opposed to sometimes some of the more kind of cold weather programs, obviously folks who are unhoused and experiencing, not being sheltered are obviously on the kind of most vulnerable front line of the extreme heat issue. But as we're looking at kind of housing conditions, utility costs and things like that rising, we're obviously trying to think about in the periphery of the more broad population that might end up having to be serviced by these programs as time goes on as well. So I always just put that little kind of soapbox piece in there. But that is all the time that we do have for today. We're about a minute. Like, you can't leave yet. The professor still could mark you late. But on behalf of the network, the Housing and Community Development Network of New Jersey, and the New Jersey Interagency Council on Climate Resilience, I just want to ask everyone to join me in thanking our panelists for sharing the knowledge they were able to. There was obviously a lot more of a wealth of knowledge that we could have gone a bit further on about, but we were trying to respect everyone's time here as well. As a note, though, the webinar is a part of a series on extreme heat education events. So this was one of many. I believe the next one is going to be focused on children and teens from extreme heat, strategies that can mitigate heat for them. And that should take place July 22nd, I believe. And you can visit the Heat Hub NJ, which the link has been provided, and I'm sure they will provide again for you to register for that. As I mentioned earlier in the beginning, kind of full circle here, all the webinars and recordings have been, recorded, as the word implies, and will be posted to the events page on the Heat Hub NJ website. Everyone who did register should receive a link to the recording about a week or two afterwards to this day. And with that being said, this is the part where I'm at the end of the script and I have clever things to say. So thank you, everyone, for joining us. Again, not happy, but thank you for being a part of this work for the Extreme Heat Resilience Week. And we need to continue the work that we're doing, especially as we said earlier, the conditions are only going to continue to rise. So, but we have a good room of experts and a great state and a great nation of experts to work with as well. So again, thank you for everyone being here. And I believe that is the end of our time.
Thank you.
Thanks for having us.
Thanks, everybody.